So selective progesterone receptor modulators are really important drugs. They're also a little bit complicated in terms of their mechanism. So we're going to walk through this. Ulipristal acetate is the main selective progesterone receptor modulator that we have, and that is the compound found in Ella emergency contraception. The mechanism for this drug is highly complicated. Sometimes it's a partial agonist. At other times, it's a full agonist in some tissues or an antagonist in other tissues. It can do a lot of different things in a lot of different tissues, even though it's acting at progestin receptors in all of them. So all receptor modulating drugs have one thing in common. It's that in some cells, they act as an agonist, and in other cells, they act as an antagonist. And this really just has to do with how each of the cells is modulating its response. Most drugs are going to be either an agonist at all the cells or an antagonist at all the cells. So these are pretty uncommon drugs to find. However, when you have a system like estrogen or progesterone that can act at many different tissues, and you really just want to narrow it down to get effects at one or two tissues, then this can help you get more selectivity. So with ulipristal acetate itself, I'm not going to have you know all the tissues it's an antagonist, all the tissues it's an agonist. The thing that you really have to know about this is that in the ovary, where you're going to cause ovulation, ulipristal acetate is an antagonist. So uli in the ovary is an antagonist. So what it's going to do is it is going to block ovulation. That's the contraceptive mechanism that you need to understand. If you're taking this drug, it blocks ovulation. So if you look at how we use contraceptives don't work by inducing abortion, they work by blocking ovulation. And that is all this drug does. So we look down here at the bottom left-hand corner. Let's look at luteinizing hormone. And we're in that first half of the month. Luteinizing hormone is just hanging out. Then right before ovulation, luteinizing hormone starts to peak. When it peaks, that's what signals ovulation. And then it kind of goes back down again. Right before and right after ovulation is the normal fertile period. So if you're exposed to sperm right before ovulation, I'm going to put a little top hat on him, then he can just wait around until you ovulate and fertilize that egg. So as long as this little guy is alive and swimming around up until ovulation and right after, then you can get pregnant. However, that sperm is eventually going to die. So if you can push ovulation until after the sperm dies, no fertilization. So what ulipristal acetate is doing is you take it right here before ovulation. It'll push ovulation further away until, in the meantime, the sperm die off. You take most oral contraceptives all month. So instead of just delaying ovulation, it stops ovulation. In this case, you're only taking it once, so you just delay it, but ovulation will then occur a few days later. So that's why these work very well as emergency contraception, but are not used for regular birth control. Now, there are people who believe that this is an abortive pill. This is absolutely not. All it does is delay ovulation. If ovulation has already occurred, then this pill does nothing. So if you've already ovulated and then you have sex, you still have the potential for fertilization. And any fertilized egg is still going to be able to implant and a pregnancy will occur. We know this because we can do ultrasounds and see when women have ovulated. And if they take ulipristal acetate after that ovulation has occurred, there's no decrease in pregnancy rates and there's no increase in loss of a pregnancy. So only works if you haven't ovulated yet. This is going to be a big issue because with new laws coming up in many states banning pills that cause abortions, it's going to be important to know that these drugs do not do that.